Hello, everyone, and welcome to Being Well with Philadelphia Integrative Medicine, a virtual series during these changing times. I'm your moderator tonight, Lance Izikov, and our topic is Honor Self. Before I turn this over to the Philadelphia team of providers at Philadelphia Integrative Medicine, I have a few announcements to make sure you have a smooth ride tonight. Number one, if the Zoom session freezes up on you, first, quit all other programs that may be running. If that doesn't clear up the problem, just click the words leave meeting and then rejoin by using the link in your confirmation email. If you are able to rejoin by computer, you can also join by the phone. Please refer to that same email for the phone number and the meeting ID. Secondly, to submit a question tonight, please use the Q&A button on the Zoom screen. We will do our best to answer as many questions as possible tonight. And for those of you who don't know, Philadelphia Integrative Medicine is run by a team of fantastic providers. Joining us tonight, we have Linda Sherlin, nurse practitioner, Zoe Phillips, physician assistant, and Erin Oriker, nutritionist, along with the founder, Georgia Tetlow, physician. Before I introduce Georgia Tetlow, I'm going to turn this over to Linda Sherland to share a centering statement. So Linda, they are all yours.
Thanks so much, Lance. Welcome, everyone. So happy to have you here. You know, we're now presented with a beautiful healing opportunity. There's a time to join together and support each other, to slow down, to breathe, communicate with our loved ones, eat well, move intentionally. Our stressed bodies and our planet is healing. PIM is ready to partner with you on your healing journey. PIM empowers, inspires change, and creates trust with patients, PIM providers and staff, the functional medicine community, and ultimately the medical community at large. PIM integrates the best of both conventional and complementary medicine to give the tools to be well. Thanks so much, and we'll turn it back to you, Lance, to introduce Dr. Tetlow.
Thank you, Linda. Appreciate that. I wanted to take a moment now to introduce Dr. Georgia Tetlow. Dr. Tetlow is a physician and mentor to clinicians. She is a board-certified integrative medicine practitioner. She is a clinical assistant professor of rehabilitation medicine at Sidney Kimmel Medical College at Thomas Jefferson University. She has completed a Bravewell Fellowship in Integrative Medicine at the Andrew Weil Center for Integrative Medicine. And she is a certified practitioner through the Institute for Functional Medicine, and lastly, founder of Philadelphia Integrative Medicine, we call PIM for short. In June, PIM celebrated its 10-year anniversary of serving patients and our community. Dr. Tetlow is not only a leader in the medical community, she is the very heart of PIM. And in my experience, Dr. Tetlow is one of the most compassionate physicians and gifted listeners. Her patience and presence really sets her apart. So without further ado, here is Dr. Georgia Tetlow.
Thank you so much, Lance. I appreciate that warm welcome and introduction. And I also want to say thank you to my providers on my team for working a really long day and then also showing up tonight to give back to the community. We want to share a healing message tonight. And the way we start our evening programs is with a brief centering. And I'd like to guide that. Getting comfortable and finding your feet. If you're comfortable, you can also lower your gaze, make any physical adjustments. And if it feels right to turn your attention inward, it's even an opportunity to close your eyes. And feel your breathing. Allowing breath to come in. And breath to go out. Gathering your attention from what might have been a very busy day for you with lots of things to attend to outside, including yourself right now and what you're paying attention to. So just imagining for a moment and just seeing if you can identify with the concept of an ocean. So our oceans are sometimes quite turbulent at the surface. And the ocean has great depth. So feeling into, if you can imagine this metaphor of feeling yourself in this way and beginning to feel yourself and your own depth and just going beneath the surface, beneath the weather, the turbulence, the push and pull, strong emotions, a busy mind, and finding your center, finding your still point. So the ocean is just so rich with resources, and it's actually supported from underneath by the earth itself. Just taking a moment in silence just to let go of the past, come into this present moment, coming into your body, and it's safe to be here. Even letting go of the future or being in that unknown. Finding your breath, feeling your body and yourself, and seeing if you can create as much safety as you can in this moment. It's safe to pause, safe to feel, and safe to be present. We'll stay here for a few moments in silence. So beginning to complete this centering meditation, you might wiggle your toes and fingers, and I often find it's really helpful to stretch, just to find any physical movement that helps you. And we have a few intentions for our evening together, and we want to share these. So we're building on our intentions and what we intend for you tonight. Our intention is that you feel connected to yourself and that you feel connected to your community. Many of you have asked us to really be present and to respond and be available so that you can feel that you have the safety and support of the healthcare providers who care for you, or that you hear messages from physicians, nurse practitioners, physician assistants, and our nutrition staff so that you can hear how we're responding and what we're offering. So we're here for you. We want you to know that and feel that tonight. And we also want to let you know that if you do need care, telemedicine is up and running in so many exciting ways in our country and all over the world. So one of the gifts of telemedicine is that it really doesn't matter where you are now. So many limitations and restrictions have been lifted. So care is available for you, and we are here. And there are these resources that are now more and more available than they've ever been before. If you are a Pennsylvania resident and you're seeing one of our staff, you're eligible for a super bill or paperwork to get reimbursed by your insurance company. And that really depends on your insurer, but we can also give you more information if you'd like to learn more about that. We're excited that you can get reimbursement for your telemedicine appointment. I'd like to move forward with some polling questions. This is something that you can participate in and answer personally. At the bottom of your screen, if you move the cursor, you might notice that there's a polling option. And you might also see that that comes up centrally on your screen. So there's a number of questions there, and we'd like to give you a chance to answer those, and that will also help us respond and serve you tonight. So thanks for taking the time, and we'll pause for a few moments. Thank you. We can see you participating and answering the questions. Thank you so much. So we won't spend too much time here. We'll give you a little bit more time to respond. It'd be helpful if you can take this time now. We're going to get ready to end the polling soon. So this is a chance to complete those questions. And we can see that more and more people are participating. Thank you. Last week when we did this webinar, and we'll be doing this each Wednesday night at 8 p.m. Eastern Standard Time, we waited until about 60% of people participating in the webinar had a chance to respond. So we're getting close to that, so we're almost finished. And when we're complete, Erin Urikar, our functional and integrative nutritionist, will be announcing results and sharing your experience and your answers to these questions. So we'll just take a poll from the rest of my provider staff. You can take a look at the respondents, and when we think it's about time to end the polling, you can just raise your hand. So Erin, thanks for leading us. And if you have any difficulty seeing the screen, just let me know. Right now you're muted, Erin.
Hi there. I'm actually having trouble seeing the responses. I'm asking for some assistance.
So also what we could do is I could become the host and share my screen. Lance, do you have any recommendations? We'll give this a moment and I can see results. So Lance, if you'd like me to read it or if you'd like to share the screen, perhaps take over and share your screen so that we can share the poll results.
I'm going to go ahead and read them out for everybody. I stayed home and get my groceries delivered. 29% answered yes, 71 no. I go out to do my grocery shopping. Yes, 76%. I very occasionally go out to do errands. Not often though. That was 50%, 57% yes, 43% no. I have told my family and loved ones and everyone I know to stay home and not go out. 90% has answered yes. If I was recently exposed to someone with symptoms of COVID-19, I should quarantine from others. 81% said yes, 19% said no. If I've traveled to New York City within the last 14 days, I should quarantine and monitor for symptoms for 14 days. That was 86% said yes, 14 no. How long should I quarantine? Stayed home for 14 days from the time I left an area with community spread is 14%. Stayed home for 14 days from the time I've been exposed to an infected person is 5%. And 81% said both of those. No one said none of the above. Prompt timely action to help stop the spread of this infection, closing businesses, schools, and advising everyone to stay at home protects each other and saves thousands of lives, we got 100%. Yes.
Thank you for reading those, Lance. It sounds like many people responded positively about getting the word out, not trying to leave the house and staying quarantined appropriately. What we'd like to see is if it's at all possible, and maybe there's some barriers we're not aware of, and we'd be open to discussing those in the Q&A, is some of the responses around the grocery shopping and running errands. We'd like to see it actually a little bit higher percentage of folks sheltering at home and following Governor Wolf's recommendations to really reduce the risk for your health and for others. So perhaps at the Q&A session, we can have some dialogue about why those percentages may be higher and the barriers you may be running into as to why you're choosing to go out. We thank everybody for responding. Thank you. That was very helpful information.
Thank you so much, Erin, for guiding that. And I thought that was beautifully summarized. And we look forward to engaging with you. We saw patients today all day, and we talked about this. We talked about what are the challenges and why aren't people not thinking that they can stay home and do online grocery shopping, and why are they going out and what's coming up and the reasons for that. So fantastic. Mm-hmm. So after our polling, I actually wanted to share a personal message. So this is a message that I prepared specifically for tonight, April 1st, 2020. And I wanted to share how I'm seeing things, and also see some of the quite remarkable and extraordinary choices that we're making as individuals and communities in our world at this time of great challenge. So please be with me as I share this personal message to you. I hope that this message touches you as many of the parts of this message have touched me. First, I'd like to read a poem by Brother Richard Hendrick. He's a Franciscan Capuchin brother or monk. He's based in Ireland, and he shared this poem, and the title of his poem is Lockdown. All over the world, people are slowing down and reflecting. All over the world, people are looking to their neighbors in a new way. All over the world, people are waking up to a new reality, to how big we really are, to how little control we have, to what really matters, to love. This poem has been reposted more than 34,000 times, and I'd like to share a little bit more of my own personal thoughts. For me, I've had an interruption in my normal. I've had more than a pause, and I'm asking myself, what kind of healthcare system do I want? Who am I? How do I think about health? And also as a we, what do we want for our healthcare system, and who do we want to be in a bigger way? I'm also noticing as I read and pay attention and communicate that integrative and holistic approaches are actually coming forward. Some of these are less drug-centered. They're looking at all the available medical evidence, and they're not just randomized control trials. We need randomized control trials as well. I was moved this morning to review the principles of what it means to be an integrative medicine provider. I'm an integrative physician, and what does that mean? Who am I? And I was very inspired to reconnect with these principles. So in integrative medicine, the patient and the practitioner are partners in the healing process. All factors that influence our health, our wellness, or whether or not we're ill, are taken into account on the level of mind, body, spirit, and also on the level of community. An integrative approach is going to use the best of conventional medicine, and it's also going to pull from complementary methods in order to facilitate our own innate healing response. Some of the effective interventions that we use may be more natural and less invasive, and we want to use less invasive whenever possible. Integrative medicine neither rejects conventional medicine nor accepts alternative therapies uncritically. Good medicine is based in good science. It is inquiry-driven and it's open to new paradigms. In addition to treatment, we're thinking about health promotion. We're thinking about prevention. And as practitioners, we commit to embody the principles I'm talking about and to our own self-exploration and to our own self-development. And we do that every day as a provider staff, and I am so proud. As a world, I hear us asking new questions. What about the people who have less than I have? What about people who don't have homes? How do they shelter in place? What about the people who don't have jobs or don't have jobs as of recently? And we learned how many there are of you on our webinar last Wednesday. So you may be a cashier, you may be a hairdresser, you may be an AC or a technician or a plumber, or you may be a chef, or what about these folks? We're talking about student debt relief, and we haven't had that in a community society discussion in a long time. We're talking about how to give income to people in some way. These are new dialogues. So what I'd like to do is share some specific examples of some extraordinary moments recently. And I was watching a video from an actor last evening, and he's creating a new series called Sharing the Good News. So one of the things I'd like to share where I would start is that Italy's Air Force has, in an act of solidarity and creating hope for a culture and a country that's in lockdown, they put their jets out and they put their red, white, and green colors, the colors of the Italian flag, and they did it set to the music of Luciano Pavarotti. So it was a beautiful video to watch that act and that thoughtful creation intended for uplifting people, uniting people. There's also a Spanish military base that's near Madrid, and that is intended usually for the production of pharmaceuticals, and that those pharmaceuticals go to Spanish troops. But now that base makes Tylenol and it makes hand sanitizer. So some of our police people, so policemen and women, and in Mallorca in Spain, they are dancing, they are singing, and they're in the streets, and they're spreading hope to the quarantined citizens who are looking down at them from their balconies. So seeing those images of our police people playing that role of spreading joy. Cuba, which has a reputation for sending medical professionals and physicians to areas in the world that have need, sent 52 of its physicians to Italy. They were sent to Lombardy, which is an area which is, has acute needs. And one of the acute care physicians who was traveling there, he said, I quote, "We are all afraid. So we take out fear and we put it to one side." These are individuals who are leaving the safety of their own country to help others, even when they're being affected themselves and their families are being affected in this crisis. So I have some questions for you. Now I feel that we are a we. I feel that we have the potential to work together. And can we work together to end some of the suffering that we've come to learn to live with? Can we work together in the way that we are working to get together now to end this virus? What I perceive as a physician working in the United States, I'm licensed and I practice in Pennsylvania. I feel that we are a very lonely culture, a lonely people. And I know that more than 1 million people die by suicide every year. So that's 1 million across the globe and about 50,000 people in our country in the United States. So can we respond to this together? Many children are hungry. We know that many people die every year. Actually, I think the numbers are something like 5 million children die every year of hunger, and so many more suffer and go hungry at night with an empty belly. 5 million is about 200 times more people than have died so far from COVID-19. But we don't necessarily treat that like an emergency. So I believe it is worth our attention, and it does deserve a unified and thoughtful response. And can we respond to these things that we've learned to live with? And can we respond together? Can we care? We lose many people every year from drug overdoses. So 70,000 in the United States alone will die every year from drug overdoses. So can we respond to this together? Can we mobilize? Can we make change? Can we move forward? Can we break through barriers? Autoimmune illness is something that we treat in the clinic every day as an integrative medicine clinic. So the figures differ in terms of how many people have an autoimmune illness in the world. So the National Institutes of Health thinks it's around 20 or 23 million people. And there's other organizations that would rank that number around 50 million people. So can we respond to these illnesses together? Can we address these root causes? And can we look to some of the solutions that are available, some of the things that we look at, for example, in integrative medicine, to look at the root causes of autoimmune illness in order to help many, many people? I personally do not want to have a nuclear war. I don't want to destroy our Earth, and I also don't want to endanger more species. So these are things that I care about and that I want to feel safe about. That's my message that I wanted to share tonight. And it's a question for myself, and it's a question for you. And it's a question about the beauty of how we're responding together and how we're feeling and seeing that we see ourselves all working towards a common goal. And I encourage us to not lose that inspiration and that ability to respond in that coordinated and collaborative way. It's really beautiful. Just making a transition, and Lance, if you don't mind, I'd like to pull up the well-being framework slide, which is the next slide. Thank you. I'd like to share something that we, as a clinic, we mentor healthcare providers in how to practice fully evidence-based medicine, how to practice good medicine. So we are integrated, which means that we really want to practice conventional medicine to the highest standard. And we also want to integrate every available approach, every evidence-based test, and also a new paradigm and way of thinking about illness by looking at root causes. And when we invite physicians and healthcare providers and of all kinds and nurse practitioners, and when we invite and we receive clinicians in our clinic, and also when we do our offerings on a monthly basis to all the local professionals, which is now actually available online. When we work with clinicians, we offer a well-being framework. And I'd just like to share this model with you tonight. It says provider well-being framework, but this is you and this is me. And this is how we think about wellness and how to be well. And this is what we practice when we gather as clinicians and we have a self-care experience. We'll tell you a little bit more about an opportunity for healthcare providers that's coming up. Let me just explain that this is looking at 3 ends of a triangle, 3 essential areas that if we cultivate these, we can cultivate well-being. So I'd like to start with the lower left, which is emotional health. So this means having healthy relationships and good boundaries, being able to attend to one's own feelings, and working with that tendency we have in modern culture to suppress our own responses and just keep going. So having emotional health is a really helpful foundation for a pandemic. Emotional health is something that it's okay to reach out for help and ask for help. Last week we asked how many people need to talk to someone or will be open to talking to a therapist. And there are quite a few people who immediately in the poll said, I need help. The next area is mindset. And that has to do with how we see things, how we see ourselves, what's the internal narrative. And we can see things glass half full and glass half empty. And the narrative is an infinite opportunity. That's a little bit what I spoke to in my sharing. Community is another end of the triangle. We are connected We are connected to our bodies. We're connected to ourselves and to each other, to the earth. And we're connected in so many ways. So feeling that connection and sourcing that is so important for health. There's a lot of data that just talks about if you have someone to call, just in the event that you have a symptom or illness and you need help, just knowing that you have someone to call is a significant, means that that individual will have much less healthcare expenditure, and much less money will be spent in healthcare when that person will just subjectively report that I have someone to call if I need help. Inside this triangle, it says the formal, meaning formal practices, and the moment-to-moment practices that help to inform our mindset, our sense of connection, and our emotional health. So formal practices that do that are things that you do at a set time in a regular way, in a committed and defined way. So it can be a form of meditation, or it can be a prayer practice, it can be visualization, it can be group or solitary, and it's a formal practice that you commit to. It takes place. A moment-to-moment practice is something that's a little bit more organic. It has to do with moment-to-moment choices. So it could be something that you choose to bring in multiple times throughout the day as a way that changes the way that you're responding or your way of being. And it's the formal practices and the more informal or moment-to-moment practices. These choices are what inform these areas, and that can build the foundation for health. So in a few moments, and actually Lance, if you don't mind, I'll just speak to a tool that each of you can use. This is actually an introspective tool that we have used for both healthcare providers as well as for the general public. And we call it a Tetlow 10. I'm just going to describe what that is. And you know what else I'm going to do? I'm going to share with you that I have my own Tetlow 10. So I didn't need to update my Tetlow 10. I'll explain what that is. You know, Tetlow 10 in a brief summary are the things that I identify that I need to do to keep me in balance. So these are unique to me, and these are things that I see as essential. So these are things that on the left side, it says things I need. So these could be habits, things that I need to remember, or things that I need to do regularly. On the right-hand side, it's listing attitudes that I want to cultivate. So this Tetlow 10 gives you a chance to reflect and to write down things that are things that you need, things and attitudes that you want to cultivate. And if you have one thing on each list, that's great. You don't need to fill out the whole thing. And I've given you as an example, the habits and attitudes that at the time that I made this document were active for me. So this is my Tetlow 10. And when I made this, what it says is, I'm realizing that I need to go to bed early. That makes a real difference for me. I'm needing to exercise and dance, and it needs to happen at least 3 times a week. I want to make time for pleasure in my life. A friend helped me to discern that and to feel how important that is. Also, community and connection. I didn't even put anything more definite than that. So I want that. I want to cultivate that. This is something I need. A regular mind-body practice. And that commitment has gotten a lot more specific since we've had a pandemic. And I have been pulled in so many different directions. The amount of media and the different communities that I'm part of, and the strain and distress that I'm exposed to in so many different ways, which is so profound and affecting me, I've had to put at the top of my list my own mind-body practice, where I have my own personal meditation practice. I have it at a certain time for half an hour every day, because what I was noticing was I felt like I was working around the clock. So this is an example of how I've rewritten my Tetlow 10. And then if you turn the page, I wrote it again. So this is something which it's good to stay up to date with oneself. This is something I presented at the Institute for Functional Medicine to all the certified practitioners. And when I was in the question and answer, Dr. Dan Lucasey, who's a medical director at Institute for Functional Medicine, he said, well, Dr. Tetlow, well, Georgia, how often do you redo your Tetlow 10? And this was in January. And I said, well, I kind of redo it every quarter. But at this point, I redo my Tetlow 10 every 2 weeks. And in the recent weeks, I've actually redone it every week, just to stay up to date with myself about what I need and prioritizing it, putting it down on paper, and then I just post it up where I can see it. And that has helped me to stay accountable to myself. And we are offering this to you. So everyone who is registered in the webinar tonight, you'll be getting a follow-up email from us. You'll be getting information on something called a 4-7-8 breath. And that's something that we actually covered last week. So this is a breath that helps with stress and anxiety and helps to regulate the autonomic nervous system. So that's your heart rate, it's your blood pressure, and it's the nervous system, helping the nervous system transition back to rest and digest, out from fight and flight and freeze. So rest and digest is where we sleep, rest, learn, it's where we make love, and it's the place to be. So that 4-7-8 breath, there's instructions, and there's also going to be a link to the Tetlow 10. So if you would like to do that exercise for yourself, you can download that. And also for those of you who are listening to this webinar after the fact, you haven't registered, you won't get that link. You can go to our website. You can go to the resources section. So on our homepage, there's a nice big button that says resources. It actually says COVID safety and support resources. And we'd love for you to visit there, download your own blank Tetlow 10 as often as you need to. And we want to support you. We want to offer you the ways that we're supporting ourselves. So I'd like to transition to a call to action, and then you're going to hear more from my great provider team. You've heard a lot from me tonight. Our call to action, this is actually specific for the doctors that I'm working with and ways that you can help us, the ways that you can support our healthcare system. So one of the things we're doing is we're trying to work together and address the specific needs. So these are also links that will be on our website if you want to click, but you can also find these easily. We have run out of personal protective equipment in many of our healthcare settings. Some of you may be aware of that. What that means is that we need medical masks. We need the surgical masks that we wear to protect ourselves when we're taking care of patients. We do not have enough. There are people in the community who are general public who actually have some masks. You may have bought them in an event to protect yourself, and you may actually have some at home. So if you have masks at home that are surgical masks, and even if you have homemade masks, and there's many places to find on the internet how to make a mask. Our family that's in New York, when we called them several days ago to check in on them, my brother-in-law showed me the homemade mask, and he demonstrated and he put it on, and it was beautiful. It was beautifully made, and he explained the ingredients, and he said, well, I just sourced these and I figured out how to make my own masks, and that's what we do. So many people will make masks, and some people make a large number. There's a wonderful story about someone in Japan who made a very large number of masks, a young person. So for personal protective equipment donation, there are drop-off sites. And if you visit the Philadelphia County Medical Society, the link is right here on your screen. So, or just Google Philadelphia County Medical Society. What you're looking for is PPE, or personal protective equipment, donation drop-off. So you can find that yourself just by Googling it. And then if you have masks or you want to make masks, we need help. I'm part of a text thread with multiple other female physicians. And we were texting today about how they're going to go to work without a mask that fits them and without a mask that can protect them from getting the virus. And they're asked to go to work without the appropriate equipment. You can help with this. We ask for your help. The next link is a very exciting link, and I am so excited to share this, and I got this afternoon. This is for something for everyone to be aware of. If you have survived COVID-19 infection, we have a call to action. If you know someone who is lucky enough to have gone through this process and is in the state of recovery and is doing well, you are out there, and we honor you, and we honor your recovery, and we hope that you're continuing to do well. There is a plasma donor registry for you, which means that if you've recovered from COVID-19 infection, you can potentially donate your plasma to help other people who are suffering. So we ask you to understand that as an option. So that's a clinical research site that's at University of Pennsylvania. And you can search for that If you just Google Plasma Donor Registry, it's for patients who've recovered from COVID-19, you'll be able to find that on the internet, or you can go to our website and the resources section, you'll see that link, you can just click on it. We've also created a video. I made a video after work on Friday, March 20th, and the video was entitled, Eradicate Corona, COVID-19 Virus Together If We Act Now. And it was by me, Georgia Tetlow, MD. And what I shared in that video was we don't just protect ourselves when we shelter at home. What we do is we slow the spread so that the virus does not have a host. And if the virus doesn't have a host, the virus dies. So if everyone in the whole world were to shelter at home for 2 weeks, the virus would not be able to survive and we would be able to end this pandemic. Please help me share this video widely and all the other videos that help to promote in the meaningful way about the shelter at home as a solution on many levels. We also at Philadelphia Integrative Medicine, we offer free consultations if you'd like to learn about integrative medicine and how it helps you. And we also have a newsletter. So feel free to go to our website. So Philadelphia Integrative Medicine, or you can Google my name, Georgia Tetlow. We have an incredible dynamic team of healthcare providers and you'll see them all here and you're gonna hear from them right now because I'm finishing up. We ask you to join our newsletter. And what we'll be doing is we don't send off messages often, so we won't crowd your email box. And we are very intentional about sending a healing message and helpful tips and staying in touch with you and supporting you now, during the pandemic, and after and onward. So at this point, I think it would be helpful for us to transition to our question and answer, which we can really highlight our provider staff and give them more of a chance to connect with you. And we'd like to open up the question and answer right now. So we want to direct you to the bottom of your screen where it says Q&A. And I'd like to introduce again, Zoe Phillips. So Zoe has unmuted herself and you can even just start to clear your breath. We'll see Zoe. She'll be moderating our Q&A section, and you'll be hearing from Linda Sherland, you'll be hearing from Erin Arikar, and we'll be responding to questions as a team. And that's how we work in the clinic. We collaborate every day to talk about patient care, and we're here to support each other, and we're here to support you. We're very proud of our work, and we're very proud of sharing it with you and this healing message. Thank you.
Thanks so much, Dr. Tetlow. So, hi everyone. I'm Zoe Phillips, a physician assistant. So I'm going to be leading the Q&A portion of this webinar. If you would look down at your screen at the Q&A button and feel free to type in any questions that might arise. We do have a question already from Tish. Tish is wondering and is stating, I'm actually not sure how to do online shopping. And I'm not sure if the selection of produce would be what I actually would have chosen. I could see how it works, but I really don't know how to do it. So this is a great question. You've heard us mention many times about delivery options for food and how this is something that we're recommending for our patients. So there are a couple different ways to do that. One of which is a website called Instacart, which is the website that allows you to choose different stores that offer the delivery methods. Many individual stores themselves are offering delivery service, such as Walmart, and they offer curbside pickup and also delivery service. So that could be a helpful link for you, a helpful resource. That's where many of our patients are finding it easy for delivery.
And my experience has been with Instacart that the shoppers do a great job. The shoppers that are choosing your produce. I just had avocados delivered, and you know, they didn't bring the smushy ones. They're ready to kind of ripen, and I've been using Instacart for quite a while, and I find that the shoppers are very responsible about what they're bringing.
Another thing to add as well, I think part of Tish's comment was that the produce that she normally would get isn't always available or not something she would choose. And I understand what you're talking about. I have had to adjust to this myself, and I have used it as an opportunity to be creative with trying new things and trying new ways to eat food. I oftentimes would buy fresh produce and would shop week to week. And now I'm finding that I'm buying more frozen vegetables. I am stocking up more than I ever have before. And I'm really taking an inventory of what staples I have in the house and just getting creative with making soups and salads or stir fries with whatever vegetables are available. That may not be my first choice, but I still might enjoy trying them. And I would invite you to try some new opportunities that maybe you haven't had before.
Hey folks, I just want to make a quick announcement too that a couple of folks are raising their hands. We're just going to be taking written Q&As today. So if you want to go ahead and write in your question, that would be great. Thanks so much.
We also had another question from someone who's mentioning that Instacart is not offering service to them. And this person is mentioning that organic vegetables are difficult to have delivered. And they say that they did Instacart once and the person could not find any of what we wanted. So there are other services available that offer shipments of fresh produce, such as Misfits Market. That is one option for organic produce delivery. And so there are many different resources available, something that we can definitely use a Google search for, but that is another option as well.
I'd like to speak to the fact that sometimes when we check for online grocery shopping, and we are encouraging our patients and our staff to do online grocery shopping rather than go to the grocery store, because that's safer. We have videos on our website that talk about how to be safe if you do need to go for a life-sustaining service, how to use hand sanitizer, and how do you take care not to touch your eyes, nose, and mouth. I think that one thing that's really important is it's understanding that there's also different behaviors when people are in a pandemic, and there's also a safety issue also with being on the road that we discussed in our provider meeting this morning. So some people are having quite remarkable accidents that are extraordinary and out of the ordinary, and that's something that we want to protect ourselves from when out on the road. Sometimes if people think that there aren't many people out there and there's just emergency vehicles, that they don't need to obey traffic lights and traffic signals. So there's a safety concern. And not to promote fear, but I can say from my own personal experience, when I had to do a life-sustaining service myself in the community recently to help to protect a layperson, a non-healthcare provider from getting the virus because they were transporting someone who was ill to the hospital. I was delivering a mask and I was out on the road, and it was a scary experience for me, which was quite surprising. I was trying to obey the traffic lights and signals and just traveling half an hour from my home. And it was quite a dangerous experience where the way that people were behaving on the road just for that half an hour experience when I was out was scary for me. And it also just inspired me to share with patients that we encourage you to stay home and do the online shopping. I wanted to say that we figured out that in terms of windows of availability, it will often be early in the morning when there's a window for shopping. So if you can't find a window for delivery, then you can go earlier in the morning to look, and there may be one. And another staff member recommended to me if I couldn't find one then, I could try at midnight when the day turns over, when those windows of delivery open. And I appreciated that. And I have never had to stay up until midnight to do that or set my alarm. I've been able to find some in the morning, but I also felt a sense of security and safety that she told me what I needed to do so that I didn't need to worry about it or think about it. And I know that I would get what I needed. I found looking at different sources, Instacart has different grocery stores. So I've been able to find organic produce and order it a week in advance because it takes some time to come in.
We also have another question from Michelle, who's mentioning that if someone else is choosing my produce, aren't they exposing themselves? And then if they are bringing it to me, it seems like then we could be exposed to whatever they pick for me if they don't have it. How is that better than us going out and doing it myself? I think this is an excellent question, and I'd like to answer that in a couple different ways. First off, when we are receiving the groceries, you bring up a good point. Someone else is, touching that produce and those bags. And so because of that, we would encourage you to go to our website at philly-im.com. And underneath the banner, we have a label here that says COVID-19 Safety and Support. If you click on that button and scroll down to the bottom of that page underneath videos, we have a video available that is a wonderful teaching point in terms of grocery shopping and how to properly clean our food. So this is something that we recommend our patients do to protect themselves and from the shoppers that obviously have been in contact with and involved in the community. But when we're not going out to get it ourselves, think about all the different ways in which we are limiting our physical contact. We are not touching our keys, and we're not touching our steering wheel. We're not touching our car door. We're not opening up the door of the grocery store. We're not touching multiple items of food. And so there's many points of contact in just grocery shopping ourselves. Whereas if we're receiving that food, then we can sanitize that properly through that link that we have available. And that really does help to limit our exposure. So that's something that we recommend, and I hope that was helpful in answering that excellent question.
Zoe, there's a question here about, do we need to, this is from Phyllis. The question is, do we need to be concerned about getting our mail? I can share what I do. Would anyone else like to field that question? Anyone else?
Go ahead, Georgia.
So this virus has been studied in the laboratory, and there's a article from Princeton that talks about how it can live on cardboard for 1 to 2 days. It can live on plastic and stainless steel for 3 to 4 days. And so in terms of paper, what we do is we carefully remove our mail and we just let it sit. So we wash our hands afterwards. And we actually keep it in the garage in a brown paper bag. And then 2 days later, we open it. We don't have to sanitize the mail. We don't have to do anything with it. We just have to wait and then open it a couple days later. And that's how we handle the mail. And I feel that that's very safe. And I don't have to worry about bringing that into my house after 2 days. There isn't any virus on that mail. And there can be objects where there's respiratory droplets. So contacting objects where you can, of course, convey the virus. So that's something, just understanding how long that virus lives on surfaces.
I think there's a great question here from Christine. Can you speak to teenagers who want to grab a kiss from their boyfriend and then return home to a family with a newborn? How can I restrain from anger and educate? You know, one thing that I find that is helpful in this time, it's really easy when we're afraid to go to anger. And sometimes I find that just saying, when I see you kiss your boyfriend, I feel afraid. I feel afraid for the baby. I feel afraid for you. I feel afraid for him. And speak of it in that fear. And, you know, maybe even encourage them to find creative ways to show their affection to each other that don't involve a kiss and don't involve touching. And, you know, I was talking with a patient today about this, and what we were speaking about, this is a beautiful time to learn new things about relationships and ways to relate in new ways. And so that might be a possibility to think about and sit down and have a brainstorm about with the teenager, with the boyfriend, and say, what are ways that you could show affection that aren't so scary and so risky?
I think it might be helpful just to touch on a point. There's a question from Sue about, do you have suggestions as to best practices to support immunity at this time? And there are some general principles that we can share. We won't make medical recommendations because that needs to happen in the setting of a personal appointment to see what's right for you. Also, sometimes there's supplement recommendations that are more general, but there's many supplements that aren't available. We've been addressing that with our own patients today, yesterday, and every day. But I would like to speak, and as a provider team, we can address this question together, which is, what are our general suggestions for our community? What are best practices to support immunity at this time? And I'd like to just review some of those basic principles. One of the things you want to think about is adequate sleep. So when you have a shorter sleep duration and you don't sleep as many hours per night, for example, you sleep 5 hours a night versus several hours more. So we know that increases your risk of getting a regular common cold, like a rhinovirus. That's just responsible for many types of common colds. So we know that sleep deprivation can equate with an increased risk of getting that cold. Other things are that if you have some sleep deprivation, that it can affect how your immune system responds in very specific ways, like how your white blood cells respond and how those immune mediator molecules, like the quantity of them. So adequate sleep also increases your melatonin. That's a natural way to do that. And melatonin is a very helpful molecule that can play a role in reducing coronavirus virulence. And that's something that's generally understood and published as data. So do you need to go out and buy a melatonin supplement? And what happens if you try and do that and you can't find it? It might be something to talk about in your family, is how we can promote sleep, how we can promote rest. And sleep hygiene means a regular routine where we're gearing down and we're thinking about how much screen time we have in the evening hours. Some people wear blue blocker glasses, and some people will do meditation before they sleep, or biofeedback devices. So these things can make a big difference in promoting your immunity. So if we can do this and help to sustain a strong immune system, this will make a difference in if something happens and how we can recover, and also our immune resilience. Another thing that we can do is stress management. So we all need some stress management, don't we? I know I do. So psychological stress and distress is going to affect our immune system. So you increase your interleukin-6. That's a molecule that goes up when you have more stress. So there's other markers that go up, and viruses thrive more when you have some of these inflammation cascades activated. So things like meditation, things like breathing exercises, like that 4-7-8 breath that we give you. They actually, guided imagery and anything that works for you to address your stress and move out of that fight and flight state, which is really being triggered by our own thoughts and emotions. That can actually equate to blood inflammation markers improving. So we measure blood inflammation all the time, short-term, long-term markers, and you can see those shift when we practice regular stress reduction. The other thing is vegetables and fruit, and Erin might speak to this a little bit as well. So when you eat more vegetables and fruit, and you can order these successfully with online food shopping, there's a lot of flavonoids in those vegetables and fruit. And what we know is that there is a specific signaling that even coronavirus is specific. It has a reputation for this specific inflammation pathway, and the pathway is called NLRP3 inflammasome. So that particular signaling pathway is inhibited by flavonoids. That means veggies. So if you eat veggies, you're going to be promoting healthy levels of NF-kappa beta and tissue necrosis factor alpha, interleukins, all these fancy molecules that you don't need to remember, just to say that these specific flavonoids have been shown to have this effect to get that inflammation pathway as healthy as possible. And they can be found in our diet and our food. And we don't need to take supplements for that. And it's always a great idea to get these things from a whole food.
Yeah, Dr. Tetlow, if I can just add to that, I think also this is a good opportunity for people to get more vegetables in their diet. And for those that are following a gluten-free program, this is the best pathway to go gluten-free, is to increase vegetables versus gluten-free replacement products. So if you think of your base for your meal as being the plant, whether it's salad greens, zucchini noodles, cauliflower rice, that would be your base that you build your other macronutrients. You still need to have some lean protein and healthy fat to help you digest those foods. It's also a good opportunity, if there's more than one person in the household, to take turns cooking and meal prepping, and to do some mindful eating where you set a time to sit down together and you sit as a household, if that's your situation, to really allow the food you're eating to nourish you, and that you focus on it as a community type of practice, and you're really enjoying the food and slowly eating and digesting it.
And it is okay for these vegetables and fruits to be frozen.
Mm-hmm. There's another great question here, Zoe. Are we ready to tackle this? Because I have some input too. There's something from Anonymous here that says, I have good reasons to believe I already had and survived COVID-19 in December. I had exposure to folks who had recently traveled to Milan back then, and matching symptoms, which were very different from any cold I've ever had. How do I get tested for antibodies now? And will that tell me if I had it for sure? Great question. So I'd like to answer this if anyone has anything else that they would like to add. This is something that my doctor group was just asking today, is where do we get a test so we can see if we've actually had and survived COVID-19? And that is testing that is not widely available right now. However, if you know that you've had COVID and you know that you can submit your plasma, that is something that we're able to do. So if you were a potential candidate for that, you could actually contact PEN, that website that I mentioned earlier, where you're hoping to donate plasma. And at that point, we'd have to assess if they have the test. I think that I'd like to share that there is a lab testing company that we've been in dialogue with, which is developing a test for 2 types of antibodies to see whether or not those the person has had COVID-19 infection. So there's acute antibodies and there's chronic antibodies. So when you have the acute infection, you form IgM antibodies. So the test will look at IgM. It will also look at IgG antibodies. Those are the ones that stay and last and continue to educate your immune cells so that you're protected in the event that you're exposed again. So I was in dialogue with David Ginocchio. He's a representative of a testing company. I'm just looking at the email here. And I was talking to him about, well, if there's different strains of the virus, if you get it once, can you get it again? And he was explaining that that's something that we don't know yet. So this testing is under development and it's going to come out soon. So this is something that we're on the cutting edge with, and it's not widely available right now, but it will be. And if you're possibly infected and recovered, I would recommend that you contact UPenn, because in the event that you did have COVID-19, you could give your plasma.
We also have another question from somebody who is mentioning that they have to buy supplements and do a curbside delivery, wanting to know how we feel about this. I think curbside delivery is an excellent option when the home delivery options aren't available. And so when we are considering curbside delivery, we still want to keep in mind those sanitary precautions that we recommended through that link we mentioned earlier on in this webinar. Many of our patients are also receiving supplements via shipments. So again, keep those sanitation precautions in mind. We commend you for staying on top of your supplements and doing your best to build your immunity in that way. So I think we're all doing our best to keep in mind that we want to keep some things in place, some normalcy in our life and our food and our supplements, and do the best we can to take precautions. So I encourage you to look at that video once more.
We're nearing the end of our hour, so we're going to get ready to wrap up. There's a last question that I'll answer as we give a final summary now. And so that last question is, what signs can we look for to know the end is in sight? And when we are actually engaged as a community, nationally and globally, and we're all actually engaging with how not to become a host to this virus, and as that message spreads, that is when we're going to we're closer to an end. So we can wait for a vaccine, but we can also take responsibility, the fact that the host needs us to continue. It needs us to survive. And we give it a less and less opportunity when we choose the right practices to prevent ourselves and our loved ones from getting infected. Finally, I'd like to, and Lance, would you mind putting up the Integrative Professionals group? This is a group that we've been having for 6 years. We'll just wait for that slide to come on. And this group is something I've led on a monthly basis for many years, since 2015. We've actually renamed the group. It used to be called Integrated Professionals. It's now called Healthcare and Integrated Professionals. So this is a great chance for any healthcare providers that are available, and not many of them are. We have this monthly. It's going to be this Monday, April 6th, 8 a.m. to 9:30. And this is for medical doctors, DOs, holistic and wellness providers of any kind to join. And it's a webinar, so it's virtual, so you can be anywhere in the world. I'd like to just mention that this is a self-care experience, and it's something that you can register and then you can watch it later, especially if you're very busy. And this is also a chance for all the integrated professionals in our area to begin to tell us and share with each other, I'm virtual, I'm online, I'm promoting my practice, and I'm wanting people to know that I'm here and I'm ready to support you. So this is how we find out our referral providers are available, so we can refer to them. We want to refer to you. We want to help support your income and your health as a provider. And we also want to know the networks that are available in the pandemic to support our patients. So this is a great thing for healthcare workers, for integrated professionals. It's my greatest joy to lead this group. I created it for my own health, and I look forward to it. And many of our providers have attended, and they know how much I love it, and also how much I receive from it, and how much I receive from you, my fellow healthcare providers, who I thank from the bottom of my heart for the risks that you take every day, for your service. Thank you. So we'll finish for this evening. I want to thank my staff, thank Lance. I want to thank for all the people that you don't see. We have a beautiful team at Philadelphia Integrative Medicine. And if you have any suggestions or comments or things that you'd like to let us know about, something you didn't have a chance to say, or perhaps that you hear when this is recorded and you're listening later, we have a staff member who's dedicated to receive those messages from you. Her name is Dani, D-A-N-I, and her email address at our clinic is Dani, D-A-N-I, at Philly, that's P-H-I-L-L-Y -I-M as in mom.com. And I'd love you to message Dani. That will be a way to get through to us, and we want to hear what your needs are. And we'd also like you to help us help you. So let's join again for next week. We'll see you in 1 week's time at 8 p.m. Eastern Standard Time. Our next gathering for our virtual talk series, Being Well with Philadelphia Integrative Medicine, Honor Self, will be on April 8th. See you then.